everyone. So I'm David Kwan. I'm the second year MSW student here, and my current internship is at New York City Department of Homeland Services, and right now I'm kind of working to revise policies for homeless families and children that are in New York City. And with us today are these wonderful panelists that we have, and I'll let you guys introduce yourselves.
Hi, I'm Mike Chakowski, and I am the director of the LGBTQ programs at SEO Family Services. So I've been in that position for going on 14 years now. I opened the program in 2001, and I've been there ever since. It's never a dull moment. And so I guess in that position as a program director, I'm constantly solving problems. Everybody comes to me with a problem. That's all I do all day is problems. So, but yeah, I've really enjoyed it. It's been fascinating. So my whole career has really been with working with LGBTQ youth in foster care.
I'm James Wells. I graduated here in 2011, and I work now both in private practice and in a school setting, part-time in middle school. And for that, it's as part of a program called the RAP program, which stands for Relationship Abuse Prevention Program. And so both in private practice and in my school job, I work a lot with children and adolescents and their families. At the school, I work with school personnel and trying to support the school and so forth. I'm also a candidate at a Psychoanalytic Institute in this area called PTSD, which I've been at for about 3 years. And so that is a support that I use for my work nowadays. Prior to that, I've worked in a preventive agency in Brooklyn doing family therapy, which I was doing when I was a student here and then continued on afterwards. I've got some family therapy training out of that. They trained a lot of the students and the staff in family structural therapy, so that's something I've sort of taken with me into the work I do now. So.
Sounds amazing since you guys were in the field for many, many years. Was children in your initial interest and passion, or?
No, because after graduating from college undergrad at the University of Southern California, so in Los Angeles, got a job in sales, and it just wasn't for me. Because they're like, come on, sell 50 cases. And they're selling wines and spirits. And so 5 cases, 50 cases, who cares? So, needless to say, that didn't last very long. So I quit and was looking for something else that I find more personally meaningful. And then I saw this ad for working with gay and lesbian teens. I thought, God, that sounds so bizarre. It's probably perfect. So I went, interviewed for the job as like a child care worker, entry level, and got the job and found out I was good at it. And after working for a year or so, I realized this job is too hard. I need to get a master's degree if I want to get into administrative position. And so that's how I ended up coming here to NYU with my MSW in 1996. And then a week before I was supposed to graduate, colleague of mine, Allen, who ran Green Chimneys, I don't know if people are familiar with that, has since closed down, but they were the original gay and lesbian program for kids in foster care. He called me up and said, oh, you know, we're going to be graduating soon. How would you like a job? So I said, well, when the job finds you, it's meant to be. So I said, sure. And I was at Green Chimneys for 5 years, and then it's been this opportunity to, at SCO, to start their LGBT program, which was the result of a lawsuit against the city by advocates for these youth. Claimed that they were more than claimed, but they had proof that they were physically, emotionally abused in foster care placements. To the point that a lot of these kids in gay kids in foster care felt safer on the streets than they did in some of these child welfare agencies. So I came to SCO, started that program, and it's been, what I found gratifying is we've really changed the agency culture because before our program opened, the agency really had no experience with, specifically with the gay and lesbian population. And, it's a huge agency too. We have like 4,000 full and part-time employees. We have programs here in New York City, Nassau County, and Suffolk County. So we're pretty spread out. But we've been having this conversation for 14 years about making these placements affirming for these young people, making them safe for young people. And when I got to SCO, like there were some houses that you wouldn't send a gay identified youth to because, not only would the peers maybe be hard to kick, but the staff might not intervene appropriately. So we come to the point where you can say, like any of our homes now, you don't have to have that fear that we know the staff is going to intervene appropriately and make sure everyone is safe. So.
How to transform it.
Yeah, and dealing with effects of poverty, racism, intergenerational effects of poverty. We have these kids that grew up in families where nobody had ever worked. Nobody had ever, sometimes these kids were the first ones in their families to go to college. So it's really dealing with the real, not even working class families, but really poorest of the poor.
James, how did you come to kind of have developed an interest or passion working with children with families?
Well, I was in the field of arts prior to being in social work school, and I had I did some volunteer work with actually the elderly population, and I had this part-time job that I was doing that as well, working with an elderly woman, and I came to have developed a passion for working with people through that, and that's what brought me into social work. And when I came into social work, I was fairly open-minded. I didn't really know what I wanted to specialize in or anything like that. And it wasn't until my second placement where I got placed doing family therapy at the place that I eventually worked at in this preventive agency that I came to realize that I really enjoyed not just working with individuals, but also, working with an entire family. And it gave me a lot of unique experience of running a group and with kids and working one-on-one with children and adolescents, and then also doing family therapy. And I liked having a mix of those things, and that's where I really developed a passion for it. And I think I was also taking some classes here that were part of the children and family flow, and I thought that those were really inspiring and had some fantastic teachers. So ever since then, I've really enjoyed it, and that's kind of something that I want to continue doing.
So at NYU, was that your learning opportunity? Like,
I wasn't part of the flow, but I ended up taking, I ended up taking a class, and I really liked it, and then I started taking, I think I took 2 more of the classes. I mean, I was practically taking all the classes from the flow, but I don't think I was actually part of it. But I definitely thought that it was a good opportunity here in the flow, so people are thinking about doing it, and I thought it was one of the better things here. It's really great classes and so forth. So.
What's the flow?
Do they still have them?
Yes.
No, it's not. Okay, all right. Yeah.
You want to tell us a little bit about what a flow is?
Yeah.
Oh, sure. So that's when, if you guys decide to, in your second year or the advanced standing year, there are some kind of special interest in social work arenas that you focus on. There's about, 18 of them? No, there's a lot. But there's children and family track. There's child foster care. Child foster policy care, substance abuse. I'm personally in the micro-macro flow, which is more macro social work level of policy. So there's all kinds of areas that you can specialize in your social work arena, and NYU kind of offers the opportunity to do that. So yeah. I hope that answers the question. And so moving along, you mentioned that a lot of what you do is probably solving problems and whatnot. And so in relation to that, what would you say are some of the challenges that you face at the beginning of your career in this work?
I guess at the beginning, I guess there's one client that just comes to mind. And so this client would, when I started out, it was like the educational coordinator at Green Chimneys. So he'd come into my office and he'd put his arms around me because I love white boys. And I don't want to love you, I want to hate you, but I can't. And so he would go on and want to sit in my lap. And I'm like, can you sit over there? And he'd be like, no. And then he'd like lay on my desk. And so I was having real struggles, like how do you deal with this kid who's attracted to you and physically violating your space? So I went to my supervisor, Gary Mallon, who is the expert in working with the 18s. And so he was like, Gary, he's doing it. What should I do? Gary just said, deal with it. So I think that was a
Thank you so much.
yeah, here's the expert. He's the expert advice for dealing with it. So
Was that helpful advice?
not really, but I kind of found my way, and I think currently it's trying to deal with providing services in an environment where money is really tight. All the audits and like Medicaid, because we get Medicaid funding, and like they'll we do these audits and suddenly say, the agency owe us like $500,000. They're not allowing some of these expenses, so it's one of the real challenges is to how do you, where do you make up when you have a deficit, which we just had a meeting yesterday. We have deficits all over the program, and where do you close the gaps? Because you can't cut back on food, you can't cut back on clothing. The only place you can really cut back is staff. So, no more overtime. But that's the real thing, that's the real struggle we have, is to use resources as productively and trying to stretch them as much as you can.
Yeah, I think that in the beginning, my struggle was a lot about, Michael sort of touched on it about supervision and feeling supported, and some of the situations that we end up in social work. I think that we're dealing with trauma, we're dealing with really difficult feelings, and people that are very, very vulnerable, and there's a lot. It's hard not to take it home sometimes, and I think that it took a little while for me to sort of realize, to find the supports that I needed, and sometimes in the agency world, supervision doesn't provide that just from the agency world. So outside supervision or groups that you can be part of. These things I eventually found, and I also found an institute, and that was sort of my impetus for finding that. As time went on, as I started to put those things into place, the work became more manageable, and I found that I was able to enjoy it more, and leave it, leave the job at work, because I think that's important for us, and taking care of ourselves.
And so, Michael, like the job found you, I kind of want to ask about the job search, but James, did you also was it a challenge for you for job search, or did the job also kind of find you in a way?
Well, I got hired at my placement right afterwards, so I certainly remember a lot of people, that happening to a lot of people, their second year placements. And that just came about. It was fairly easy at the end. I think there's a number of us interns there, and they offered us all jobs. And then I kept in contact with a lot of people through Facebook and LinkedIn, so people would periodically from my classes would post jobs and would list stuff that way. And so my second job I found through that means. So it sort of came up, I don't know, about 6 months or more later that this other opportunity came up, and it seemed like I had done the job that I had my placement for over a year at that point, and I was ready to move on, and so that's how I ended up finding that. And I still actually, through a lot of my classmates, hear about opportunities that come up. So that's a good thing to keep in mind. And I guess I didn't really think about it when I was going to school, but your classmates can definitely help you later on. So this is really just the beginning of making connections with people. So
Yeah, well, I was going to say, because I'm on a number of work groups with advocates for the LGBT youth, and so I would encourage you to volunteer for this stuff and take on extra responsibilities at your job, because by being part of these work groups, you can really network and meet a lot of people, and you can hear the inside on jobs and who's being, what jobs are coming online. So
Kind of in line with that, for students who are interested in working specifically with children and families, what experiences, courses, you kind of talked about this, and additional experiences and training would you recommend for those kind of students?
Well, I remember, are you saying like here in school or outside of school, or both?
Yeah, both are overall, I guess.
Yeah. I remember in school here, Donna Friedman's classes I thought were really, really great. She worked a lot with children and families, and I took a class with her on attachment theory, I think. I thought that really got me interested. And Teresa Aiello, I don't think is here anymore, I'm not sure, but she taught some classes in that. And then I guess just through my people that I've worked with at my jobs and through people that I met here in social work school, I've heard about, other trainings, and I ended up joining a group that focuses on, a supervision group that where we talk about cases, and it's all people that work with children, and so that's definitely been very helpful.
Do you have any feedback?
I think, especially working with, like in foster care, it's, you're going to be in a situation where they're going to really push your buttons and say things and do things to you that, because I stopped saying, God, I never thought I'd see that happen, because as soon as I did, like, something even more bizarre happened. To give an example, about 3 weeks ago, I was in one of our homes, and we had this very, very mentally ill trans-identified youth who got into a fight with a peer, went to the closet where we keep the knives locked up, kicked in a wooden door. So I went to try to intervene and direct her away from the door, and she kind of flung me out of the way. And I'm like, man, this kid is strong. So she ended up getting 2 knives. So she had 2 knives in her hand, and was telling everybody in the house that she was going to slit their throats and she was going to commit murder. And so I'm like, come on, let's go have a cigarette. Do you want a cigarette? I was going to buy her a pack of cigarettes if she would drop the knives. And at this point, this kid was like really disassociated, and ended up stabbing a chair with the knives, and then started stabbing at the wall. And it's only at the point where the knife kind of bent that she kind of came out of it and like dropped the knife. Grabbed a chair and threw it through the window in the dining room. So it was a happy ending, So, and then we had, called, put in a call for an emotionally disturbed person, and so now that young person is at the, I think they're calling it New York City Children's Center. So it's like the state hospital out in Queens. From what I hear, that the hospital staff is having a hard time dealing with this young person. To the point where people are calling out from work. But yeah, it gets scary, because that was a real safety issue. Like, how do you, this young person needed to be in like a psychiatric facility, and nobody was willing to really make that happen. So we had to step in and kind of make it happen, and put this whole plan into place, and get her psychiatrist on board with it.
And how long did you get it?
Oh, it took about like 3. Well, she was hospitalized at Bellevue the next day, and then at about 3 weeks, a bed opened up in Queens, so they just transferred her.
It's a really good example of the work that is done.
Yeah, so sometimes, yeah. But especially with the young people, you see there's a lot of violence, there's a lot of trauma. So I think, any study you can do about trauma theory is helpful. There's so many layers of trauma with our young people that it's hard to know where to begin.
Was any of so was that surprising to you? I kind of want to ask also about like what part of your work was surprising, good or bad, in your work throughout your career. What are some of
I think the most surprising thing for me is that I've been at this job for so long, and it never really got boring because, things would change and, the program would expand. And so I always felt I was learning new things, so it never felt like a static kind of position. And then, was it 2 years ago, we opened up a detention program. And so I learned a lot from that experience. The most important thing being I cannot work in corrections. It's just not for me. And again, those youth were very, very difficult. Like half the staff was out, that was leaving on medical grounds because of injuries they suffered in the course of employment. It's part of the Close to Home program, so they've shut down all the upstate juvenile prisons, and they've opened up a whole network, like 300 beds here in the city for these young people. So the idea is to keep them in the neighborhoods where they're from, keep them connected with family, and so when they get released, they do released with family therapy and aftercare. So, because before we take these kids, they do a crime here in the city, send them up, 6 hours upstate. They do their sentence, and then the day after they get sent on a bus and plop right back into the environment where they came from. And so, the recidivism rate was nearly 90%. And so I think this is a better model because it's really helping the kids negotiate the neighborhoods where they live and where they're going back to live, and trying to give them strategies to stay out of trouble.
The work that you do is more aligned with, I guess, your values than kind of the corrections or
yeah, because it's a different mindset, correct? Because it's really, corrections is really about power and control, and the city really, touted like the therapeutic qualities of this Close to Home program. But if that came into conflict with the AWOL, because the kids, because they're in the communities like, single family homes, and so if they were, all the doors were alarmed. They couldn't leave. We had to put bars in the windows and to keep them from sneaking out. But they would still find a way to get out and go AWOL. And so the city, the folks at this just would have a fit. Like these kids were AWOL. And so they kept saying, well, we need to restrain them. We need to, sort of physically prevent it from leaving. And I don't know if anybody's ever done a physical restraint. It's not a very pleasant experience, and so I was just so frustrated that these people who had never had to restrain a young person were just telling us we're not restraining enough.
James, can I also ask you?
Yeah, I was thinking about what Michael was saying. It reminds me of the tension, and I don't know if any of you are interested in working in schools, but that sort of tension between the social work values and the values of the school is there as well. Power and control is something that schools are interested in dealing with their kids, and their focus is more on grades and attendance and behavior. And for social workers, people that are trying to do therapy in a school, that's not really what we're concerned about. We're more interested in getting to know the person and getting to know them on a deeper level than just controlling their behavior. So in dealing with the school, it's I've learned it's almost like treating the school like it's a client in a way, and that that the role of a social worker in the school is really to provide support to them, and almost it's not really therapy, but it's kind of helping them feel supported, and there needs to be a buy-in, because the school can really sabotage the work in a lot of ways. It's kind of similar to now in private practice, I work with parents and their kids a lot. I work more with parents in private practice because that's how they come to me, and involving the parents as much as possible helps them to allow their child to be in therapy and have a relationship with a therapist. So that was just something that came up listening to Michael speak. And I'd also say too, one challenge that I've noticed in working with children in particular is because children can't really talk about their feelings so much, and so much of what we do is like play therapy or things are acted out in a way rather than like talked about. And I think it's the challenge with that is that it means that we take in a little bit more of what they're feeling and what they're struggling with. Working with adults, I work with adults also. When somebody can speak about their feelings and tell you how they're feeling, we don't take in as much, I think. So that's another reason why working with children, in working with children, we need to have a lot of support around that and a lot of outlets for what we're taking in as their social worker. So.
And as I was going to add, in our group homes, to tell a teenager like, oh, you're going to meet with a therapist, that's going to go over really. Yeah. So what we've done is what we do is called milieu therapy. So we kind of embed a therapist in the day-to-day activities of the group home. And so she'll invite the people out. Let's go have a soda. Let's go for a walk. And then that's when the therapy happens. It's very kind of unconventional. Going for walks, going to have a meal, because they already learned good about showing up for appointments in a particular time. So,
yeah, that word therapy is a killer for the treatment sometimes. And it's so interesting to me, like so many of the kids that I work with, they don't consider what we're doing therapy, even though it is therapy. And it's like, oh, this is my time to come and play, Uno or play. I sometimes let kids play games on my computer, that we play games or look at pictures of toys, of Legos. This morning I was looking at an hour's worth of Batman Legos and so forth. And it means something different, but the relationship is really just as powerful as when we think of therapy, with adults or whatever, but they may not call it that. Some people think of me as a counselor, they think of me as a teacher, and it's interesting to get them talking about that. You kind of see, how they think of me and who I am to them. Those are things that are interesting to find out if you're working with children.
Do you use the word therapy or try to frame it in a way, or is that not?
I don't really use the word therapy. No, I would say. In fact, I don't even use the word counselor. Sometimes I'll use counselor. If they ask me what I am, I'll say, oh, I'm a counselor. But then there's other counselors at the school. There's guidance counselors, and these people do very different things in the school than I do. I guess I try to give them a space to create me however they want to, and as long as they're coming every week, and as long as they're showing up, then we're, as far as I'm concerned, we're doing therapy at that point.
I just want to say, I really appreciate that there's so many perspectives that you guys bring to the table. I personally am in the micro-macro flow, so I really sometimes get interested in talking about how do we combine micro-social work with macro-social work. It seems like both of you guys kind of bring that perspective to the table as the director, as a family therapist. So how would you say in your work you kind of combine the micro and the macro piece in working with children and families? And it's kind of,
Well, I mentioned, working with, seeing the school as a whole, as a client. That's something that I think is, some way to do that. Also in my program, our funding has been in jeopardy at various points. So they sometimes ask us to, go to rallies. We get interviewed on TV. I think a few of my coworkers have gotten, interviewed on the news involving like domestic violence issues. And so we're fairly politically active in that way. So that definitely comes out in the work also. But it's something that you can't really ignore, I think. I don't think you can really ignore the macro because at the end of the day, in the agency world at least, that's your job. So, to survive in your job, that's something that has to be considered.
Yeah, I would, what I was just thinking of is our direct care staff, as you call them, house parents, they really reflect a lot of our young people. Sometimes they come from the same neighborhoods, a lot of times the same socioeconomic kind of backgrounds. Most of our direct care staff have high school diplomas, so these are good jobs. It starts at $12 an hour and goes up, and full medical, dental, 403B. So it's some really good benefits, and so it's for somebody with a high school diploma, it's a good opportunity. But what we kind of struggle with is that a lot of these folks, since they don't have education, they will kind of work with our youth like the way they would treat their own children, and we have to work with them on that. It's like you can't treat them like your own children, and they'll say, well, this child is like 19 years old. Why can't he go out to this appointment on his own? So we have to continually educate them. Even though he's 19, he's functioning on like a 13 or 14-year-old. And so to kind of educate them, and educate them about trauma and how that affects a person. So this young person doesn't just be annoying to you. Their brain has just been wired in such a way that they can't help. And so getting them to understand that kind of treatment approaches, and educating them about mental illness. Because we've had youth that have been psychotic, like schizophrenic. That's over the years, several people have been schizophrenic, and the staff have a really hard time dealing with really serious mental illness like that, because they just don't understand it. And then another challenge we face is like, how do you keep people motivated and energized when we haven't had any cost of living increases in salary in like 40 years. The state hasn't provided any COLAs for them. But apparently this year or next year it's going to happen. So 4% But it's tough, because our staff haven't had raises for years. The rent goes up every year, and metro cars go up, and the salaries will be the same. So.
sometimes problems get like it's still a problem, we have to deal with. So just looking for time, and I want to give people to ask you guys questions. I'll ask one more quick question and then kind of open the floor. How would you say your current job fits into your career goals? And I guess I'll just end with that question. Did you have in mind this was, do you want to? I want to someday be this after this many years in career. Kind of, how did what position you have now? Sorry. Oh,
Yeah.
question. Yeah.
Well, no, because in my field placements in social work school, I saw like these program directors, and I was kind of, God, I could do a better job than because I knew I could, yeah, and I did. Yeah. Because we're the only program left in the city working with LGBT and foster care, so that's my standard. So I've kind of achieved my career goals, so I have no other goals. I have to come up with some new goals.
And it's still a very ambitious career goal to do better than, maybe former people did. Yeah.
Well, she's kind of
Say.
So I'm in the process of coming up, trying to figure out what my next second half of my career is going to be. Haven't really figured it out yet.
Well, yeah, my agency job really does fit my needs a lot at the moment, in that it's fairly, it's part-time, it's not a huge time commitment, and at the same time, it also gives me this great experience of working with children, which is something that I'm interested in doing in private practice. As my private practice builds and gets bigger, eventually I'll leave. But at the moment, it works. That was my goal coming into social work school, was, eventually to do private practice, and, that's what I'm doing. But this is, my experience in the agency world has been really great, so, and it's been a phenomenal learning experience as well. So, yeah.
Thank you so much. Do you guys have any questions that you would like to ask panelists?
I have a question for Michael.
Yeah.
Earlier you spoke about being the program director and dealing with the issues of deficits and trying to decide where to cut funds. And so I was wondering, as an MSW student, were you prepared for those kind of decisions through your education? Or did you feel that going into a position as a program director, maybe you need some business courses as well?
Yeah, well, the whole budgeting and supervising employees, that has always been like an interest of mine from very early on in my career. So it was something that I was just kind of drawn towards. And I did do a dual degree with the Wagner School in nonprofit management. So that was helpful to have that kind of background, But with budgeting, it's all about adding and subtracting. So if you can do that, you can. It's really about allocating resources and looking at costs, making sure the costs don't get out of control, and coming up with plans to how you're going to resolve that.
I guess I asked because I always thought like program director is the person that you go to for clinical issues only. So when you brought that up, you kind of made me start thinking about that, and that you're in charge of those kind of things as well. But on the other side of it, as the program director, do you feel like you ever have days where like everyone comes to you for answers as the program director? You have days when you're like, I don't know what to do.
It's every day is like that. So I don't have the answer, but I might know who can give you the answer. So that's I do a lot of that, telling people who they can go to get the answer. And so the way we structured it, like I have a director of social services that works in she's kind of like a co-director. So she kind of looks after the whole clinical piece. And so I kind of focus on supervising the house managers, the experience manager for each house. And so I focus on facilities, and our director of social services kind of focuses on the case records. we kind of divided the tasks that way, and it's worked out pretty well. Because I like doing
They offer those kind of classes here.
It's like a grant writing course, and we spoke about how you guys were contributing to music funding. I was wondering if you really know if you had to help with grant writing, because I didn't take the course, so I was like,
There are people in the agency that do that, for sure. They should offer that. That's a great idea.
Yeah, Michael, do you have any chance to do clinical work or just totally removed from it or?
Yeah, you know, during my time in school, and as soon as I get out of school, I kind of have a feeling that, like, doing private practice, it's very, I don't know, from my point of view, it's kind of elitist. So you're serving these people that can pay, you know, hopefully, you know, not using insurance, so they can pay cash for the sessions. And you know, there's so many people that can't afford to do that really need these mental health services. And
No, but
nobody's really
clinical
interested.
work in your city, not outside, just where you are. I mean, because it sounds like you're doing all the administrative pieces.
but the event at the lives,
That was good.
That's good. Yeah, but even, you know, supervising employees, if you use all your clinical skills, because if somebody's not, if they're having a problem with performance, you need to kind of figure out, get them to open up and talk about what's going on, get them to talk about what are some possible solutions, kind of contracting with them, and place. So, I mean, those clinical skills are essential, for, especially when supervising employees.
Clinical skills can be used in, you know, many ways in the field too. I mean, I've known people that have had bad supervisors and, you know, use their clinical skills with their supervisor as a way of, you know, managing that situation. So, you know, with coworkers or, you know, I mean, I think they're really transferable to a lot of areas that we encounter, not just with our clients, with our clinical clients.
Anybody else?
I have a question for you. I've noticed here that you're MSW, so I didn't know you could do private practice.
No, that's actually, maybe I made that mistake. I said this, so it's LCSW.
Oh,
So, yeah.
oh, okay.
I did not.
Michael, this is a question for you. So the story that you explained with the girl with the nanny, that, I mean, to me, it sounded like a very traumatic experience. And I'm sure you deal with those kinds of traumatic experiences, I don't know, on a day-to-day basis. How do you deal with that? Like, what's your self-care of, you know, still going to work the next day after experiencing something so traumatic like that?
I don't know, I guess it's kind of feeling kind of responsible for the staff. So, you know, because I was just there that one night, and I had staff that was with this child like hours and that day after day. And so I just thought, like, wow, if they can do it, they can stick with this child, because she was just exhausted. So if they can work 8 hours every day with this child, and they'll come in like a couple times a week, if they can do it, then, you know, I have to, you know, kind of be there for them and really help support them. So I kind of feel a responsibility for them, to the staff. So for me, I think just, you know, exercising, you know, physical stuff, I think really helps me deal with stress. Yeah, so for me, it's important to kind of schedule that time.
Well, thank you so much, Michael and Denise.
I also set out some brochures about the program. People are interested, feel free, and some materials that we used in the family therapy.
And are you guys sticking around with that project?
Yeah.
Anyone has any questions? They're here. I know people in class